Hey everyone, my name is Dr. Galatea Strong. After getting 100% on my NPTE, I co-founded SPT with me, designed to help DPT students who are just about to take their NPTE actually understand content versus just trying to memorize everything. If you find this content helpful, check out sptwithme.com for our 3- and 6-hour course to help you pass. Now onto what you're actually here for, let's talk about soft tissue mobilization, or STM. First off, what is STM, soft tissue mobilization? It's a technique that a physical therapist uses to address soft tissues that have restrictions or some sort of impairment. Now, why does it need to have an impairment? Well, why would you treat something that's considered normal, or at least is considered within functional limits, right? You really wouldn't need to treat something that doesn't have an impairment. Soft tissue is considered to be anything that is not subjected to the process of ossification or calcification, such as that of our teeth or our bones. Now, oftentimes when we think about soft tissue mobilization, we think about working on our muscles, right? Addressing fascia, maybe working on tendons. And yes, that is all true. However, soft tissue can also include practically anything in the body aside from, like I mentioned, bones and teeth. So this will include blood vessels, lymphatic vessels, organs, fat, ligaments, joint capsules, and even harder structures like our labrum and meniscus. So yes, you can have an effect on a labrum and your meniscus with STM. So to bring all of this together, soft tissue mobilization is a technique where a physical therapist either uses their hands, their forearm, elbow, pretty much any body region as long as it's indicated. Or we can even use a tool, which is the concept of IASTM, aka Instrument Assisted Soft Tissue Mobilization. And we do this to address limitations that may be present in any soft tissues of the body. So for example, the most common one that people probably think about when you think about STM is your muscles. You're addressing your muscles that are tight. They have a restriction. So you use STM to make it less tight, make it more flexible. As you can see, there are plenty of different types of soft tissue mobilization techniques. And within each one of them, there are specific ways to do them. And within these specific ways, they all have unique purposes. Depending on the direction that you perform them in, whether you're giving broad contact versus specific pinpoint contact, the amount of pressure, right? Light touch versus deep pressure. If you're going slowly versus quickly, if you're going in circles, etc. Now, all these factors are going to have a different effect on each individual tissue type. So meniscus versus ligament versus muscle, etc. So one speed and one depth is going to be better for breaking up certain tissue types like adhesions, while the same speed and same depth would just be terrible if you're trying to address the lymphatic system. In this lecture, we are not going to go over every single tissue technique, but instead we are going to rationalize the use of STM through the knowledge of our anatomy. To make learning about this content simple, you need to think about the anatomy of the human body. If you know where the tissues are and what their functions are, the rationale behind applying STM techniques really is not that overwhelming. The most superficial layer of our body we have is the skin. Okay, we go deeper, then we have fats, then deeper muscle, then bone. Now, of course, this is true for areas that have our limbs, so our legs, our arms, our feet, our hands, as well as our head. But remember that we also have a different section of the body, which is where our organs are. So in this section, it would be a little bit different, right? We would still have skin, fat, muscle, but deeper to that, it would be our organs instead. So our liver, small intestine, large intestine, pancreas, etc. There's no bone here necessarily, or at least ideally not. Now, without even thinking about the type of STM technique, think about what is present anatomically within each respective layer that I've mentioned. Now, the reason why I'm having you think about it in this way is that, as with all things treatment-wise related to physical therapy, you need to do things with a purpose. So if you know how hard you're pressing, how deep you're going, or how light you're going, and in what direction, and all those factors that I mentioned before for the techniques, if you're performing STM to address a specific soft tissue structure, you need to know where it is. So if I wanted to address the gastroc muscle, I'm going to push harder than if I wanted to address the lymphatic system, because the lymphatic system is more superficial to it. You just bypass it. Now, for the gastroc muscle, right, I could go in the direction of superior to inferior, inferior to superior. I could do medial to lateral or the opposite lateral to medial if I wanted to do some cross friction. Now for the lymphatic system, I would not choose to do the lateral directions. So I would not do medial to lateral or lateral to medial. So if you know your anatomy on a large scale, but also a small scale, you're going to be able to discern what technique you're choosing to apply and for what purpose. So we are going to start with the most superficial layer, which is the skin. Let's look at just the skin layer. We have our epidermis, dermis, hypodermis. For the purpose of this lecture, I do not necessarily care if you know what is in each specific one of these layers. I really just need you to know what's in the skin layer as a whole. Now within all of these layers, we have soft tissue structures like blood vessels, lymph vessels, Meissner's corpuscles, Pacinian corpuscles. Now, just a reminder of what these two corpuscles do. They are mechanoreceptors, meaning that they sense pressure and vibration, right? Now, of course, there are other structures in this layer. You can see them on the screen, but I didn't necessarily mention, and that's purely just because these specific ones that I mentioned are those that are commonly addressed in physical therapy related treatments. Doesn't mean that they're not useful in other practices. So let's put everything together and make sense of why I'm even bothering to go in such depth, right? Let's say that I use my physical therapist's brain and knowledge, and I can identify that my patient's swelling in their knee is either the most or one of the most limiting factors that are not allowing their knee to have full range of motion. So I know that I want to address the lymphatic system. Well, looking at this picture, I know that the lymphatic system is on the skin surface. So to be able to stimulate the lymphatic system, I need to put just enough pressure for me to actually address the lymphatic system. So you're looking at the layers of the body, right? We have the skin, then fat, then muscle, then bone. If I were to put so much pressure that I'm essentially sitting on this person's knee, there's so much pressure that it would just bypass the skin layer and go straight down into the bone. But that is not my intention. What I need to do is put just enough pressure, light pressure, to be able to deform the skin layer only. That way I can address the lymphatic system. Again, if I go any deeper, such as trying to get into the muscle or all the way down to the bone, I've completely bypassed the lymphatic vessels and I am just obstructing them instead of allowing them some give to be able to deform and assist with that flow of lymph fluid. The pressure that we would put would be exceptionally light compared to the rest. Again, it's on the skin surface. Now, another example, if I had the purpose of trying to desensitize a person who's presenting with hypersensitivity or allodynia of a region, I could take advantage of my anatomy, knowing that the two corpuscles that we mentioned, right, Meissner's and Pacinian, they're also present in the skin. So with super, super light pressure from my hand onto this person's, let's say, shoulder region, I can stimulate these corpuscles and hopefully override the information that's being given by the nociceptors with these mechanoreceptors, and hopefully not continue to feed into that pain spasm pain cycle. Here I wanted to give another view of the skin layer. Now this diagram actually shows the fascia. Fascia is everywhere in the body. Now there's some organized fascia that you can imagine surrounds muscles, it's between muscles, it's within muscles. Then there's fascia that's just incredibly disorganized. They just interweave everywhere. Fascia can connect from the surface of the skin and go all the way down to the bones, and in other cases, the organs, yeah? The reason I mention this is that if you identify that someone has a fascial restriction, you can't necessarily just choose to address only the superficial region or only the deep region on a guess. You need to test it by seeing how much pressure you actually have to apply to get to that restriction. Can you feel the restriction if you're pressing lightly, or can you only feel it if you go deeper into the tissue? Wherever you feel that pressure and wherever you feel that restriction, that's how much pressure you need to apply to address that fascial restriction and be able to tease it out. So unlike the lymphatic system, where unless there is an infection or something like that, you can't really feel the lymphatic system. But with the fascia, you can feel it, right? It's going to feel a little bit harder if you're using an ISTM. If you're using a tool, then you can feel a vibration on your tool. So with fascia, it's just a little bit different. You don't necessarily need to know the anatomy as much compared to other tissue types. Next layer is muscle. When we think about STM with addressing muscle, easily the first thing that comes to mind is to relax the muscle, right? It's a massage. Now, of course, you definitely can use STM for that reason. If someone has a trigger point, they have hypertonic muscles, etc. However, there is definitely more than just that, and we will talk about the uses of STM later, but just to go over some a little bit, you can use STM to do the opposite of relaxing the muscle and actually choose to stimulate the muscle, right? AKA facilitation. But regardless of what STM technique you're using, what direction you're going, broad versus specific contact, and for what specific purpose of the muscle, so relaxing or stimulating, you need to make sure that you at least apply enough pressure to get to that muscle, meaning you need to bypass the skin, you need to bypass the adipose tissue. So I want you to look at the MRI cross-section image of the thighs that's on this screen. So aside from what the image is trying to tell you, which is to stay active, this picture hopefully really makes you think about how everyone is different. So someone who has more adipose tissue, you're going to need to press and push a little deeper into that person's body to be able to reach the muscle tissue compared to if you're to press into someone who's incredibly lean, right? The muscle is a lot more superficial or less deep compared to those who have a little bit more adipose tissue. And additionally, know that muscle extends all the way down to the bone, right? Because that's where it attaches. So you also need to consider how far you need to go for superficial muscles versus deeper muscle tissues. So that's something to be mindful of. If we go even deeper toward the bone, we can hit the joint capsule and structures that are reachable inside the joint. So you think about joint mobs, right? Joint mobilizations. You're deforming the joint capsule. If you press into the joint capsule, it's like pressing into a tendon or a ligament. You can use soft tissue mobilization to address it. Now, it might not be as effective as a joint mob, but you still can do something to it, right? It's kind of like the idea of the theory of massaging the IT band. Some people say you can deform the IT band, and that's why people do all these soft tissue techniques on it. But other people say that even with the weight of a tractor on the band, you will not have a single impact on it. So there can always be limitations on what your technique provides. But again, soft tissue mobilization is to address soft tissues on a global scale. You, as a practitioner, just need to do some research to see how efficacious it is for certain types of soft tissues. So again, if you push hard enough into a person's body and you bypass the skin, the fat, the muscle, and joint capsule, you can touch structures like the meniscus or the labrum. I mean, that's what palpation is, right? You're digging deep enough to identify the painful source. The only difference with STM versus palpation is that you are not just pushing it, right? You're not just pushing straight in. STM, you're spending a little bit more time there. You're giving sustained pressure. You're moving, direction up and down, side to side, something like that, right? Just understand that technically you can do STM to all soft tissues. Whether it's indicated or not, though, and again, how efficacious it is, that is a different story. Like I mentioned before, the body is not only skin, fat, muscle, and bone. It's skin, fat, muscle, and organs, right? So our organs are made up of soft tissues, meaning we can do soft tissue mobilization to affect these organs. Now, a good example is with our large intestine. Our large intestine also has muscles, right? So if we are stimulating the muscles, right, you can relax them, you can make them contract, you can facilitate them. We can do these things as PTs. So what you can do is put a little bit of pressure along the tract, along the root of the large intestine, and you can actually help the person go number 2. Now, unfortunately, this is something that not actually all PTs know. I remember I gave some advice to a patient who had asked me about that, and I documented it. I actually did not touch them for that reason. I think they were there for knee pain or something, but they had asked me, and I just kind of told them, hey, this is something that you could do to relieve yourself, right? Now, my supervisor actually took me to the side. She saw in my documentation that I had talked about, and she said it's not within the scope of PT, and I actually stopped her right there. I said, actually, no, this is something that physical therapists can do. So unfortunately, not everyone knows it, but I mean, just to broaden your horizon, we can do a lot as PTs. So I've been talking a lot about, how much pressure you need to apply and different amounts of forces to different anatomical structures, right? So now, how do you know how much force you need to apply? So let's start off superficially again. Now, unlike fat and muscle, the structure that's most consistent with humans is skin thickness, right? Now, of course, between people and within people, right, the different structures, our hands versus our thighs. There's thinner skin, there's thicker skin, but ultimately it's not that much different. So if you wanted to address the skin and the structures inside of it, Meissner's corpuscles, Pacinian corpuscles, lymph vessels, etc., research has been done. You apply about 1 to 4 ounces of pressure. Anything more than that, you're going to bypass those structures and address the layers below. So that's kind of a set value. Now, what about all the other structures, right? Muscles, ligaments, organs, etc. Well, like we talked about in the previous slide, people have different amounts of fat. They have different amounts of muscle. So it's really hard to set a specific range of pressure. I mean, you're not going to put as much pressure for a thin person as you would for a bodybuilder, right? So the best judgment would be, ask your patient, are they having pain? Could you go a little bit harder? Now, of course, if a person cannot feel it, then it's probably not a good idea for you to do that. It might not be indicated, but just understand, right? You kind of have to talk to your patient to see, can you go a little bit harder, or are you going a little bit too hard? But at least you can make that judgment. At least it's 1 to 4 ounces of pressure if you want to go anything that bypasses the skin. All right, the effects of STM. This looks like a ton, but really it should be kind of a review of what we've gone through over this entire lecture. If you want to address a muscle, what can muscles do? They can activate, they can stretch, they can strengthen, they can have spasms, contractures. Well, you can use STM in specific strokes, specific speeds, directions, etc. to address these specifically. If you're going superficial at the skin, again, you can use it to stimulate the corpuscles, reduce nociceptor feedback of pain. You can stimulate the lymphatic vessels to get fluid in and out of the area. What you can do is improve blood circulation since veins are present in there as well. Let's say you have some fascial adhesions following a surgery. You can tease these out. You can reduce the scarring at the skin level or even deeper to the skin. Just make sure you apply enough pressure. There are plenty of reasons that you can use STM. As you know, SPT with me is an NPTE prep course platform. So until you've passed the NPTE, keep sticking around with me. But once you're done with the NPTE, you need to think, what is next for you? If you're interested in Travel PT, or you're like me and you just want to live through those that are in Travel PT, go follow and check out Tyler and Carrie on YouTube and Instagram. They are exactly what you would imagine Travel PT is all about. They are super active, they're always doing something outdoors, always smiling. It's almost like they enjoy traveling or something, right? What a shocker. Now I'll tell you, I personally followed them while I was still a student, so I can definitely vouch for what I'm telling you, okay? Now, aside from all the fun things, they're also very super informative on what you need to know about how to navigate the professional side of Travel PT, filing taxes, what to ask your recruiter, interview tips, among many other topics. And if you want to ask any questions about Travel PT that you can't seem to find online, they are more than willing to answer your questions. So just shoot them a DM. Check them out. Lastly, here are the references that I used. Thank you so much for watching this video. I hope you enjoyed it and stay tuned for more.